The COVID-19 pandemic has posed unimaginable, unprecedented, and highly unpredictable challenges for all of us in the world, across the country, on Long Island, and here at Stony Brook University, where we are just 3 days away from opening our doors to students on campus and virtually. Today, we'll take a look at what the campus environment will look like starting this Monday, August 24th. We'll look at all we've done to create the safest, most secure conditions for our students. We'll see how our student affairs, academic success, and health services teams have collaborated with their colleagues across campus to help ensure that our students have the best possible experience. We'll discuss measures like COVID-19 testing, screening, virtual advising, counseling services, face mask regulations, social distancing protocols, hybrid learning scenarios, and much more. And we'll delve into students' most frequently asked questions as they've worked to prepare themselves for an academic year like no other. I'm Larry Zacharies, Interim Chief of Police and Assistant Vice President for Campus Safety, and I'll be moderating this afternoon's Beyond the Expected podcast, Coming Back Safe and Strong, Welcoming Back Students. And I'm pleased to welcome to the conversation today my colleagues, Dr. Marissa Bisiani, Assistant Vice President, Student Health, Wellness, and Prevention Services, Dr. Rick Gatto, Vice President for Student Affairs and Dean of Students in the Division of Student Affairs, and Dr. Shelley Germana, Associate Provost for Academic Success in the Division of Undergraduate Education. We also invite you to join our conversation with your questions and comments on Facebook Live. Before we have a more free-flowing discussion, I'd like to give each of our guests the opportunity to introduce themselves and talk about for a moment what their priorities are for this fall. Rick, tell us about your role in student affairs and about what welcoming back students this year looks like compared to years past.
Sure. Well, thank you, Larry. And we're really glad to be here and get to say hi to all our students and families who are joining us live. It's been quite a journey the last 5 months. And I think we've all, I know as a team, worked so well together to make today happen and welcome all our new students. So in student affairs, a lot of the work that we've been done is really everything outside the classroom and preparing students to engage in campus life. But I think one of the big changes that we've seen is obviously having so many students be in online classes this fall. It has, I think, really allowed us to think differently and creatively about how we engage our students, and realizing that while we had the traditional campus just 5 months ago of everybody on campus and commuter students taking in-person classes, that's changed quite a bit over the last few months and will continue to evolve in the fall. And so we know in the work that we're doing in student affairs, we need to look at ways to build a sense of belonging and community with our students, even those that are not going to physically be in our campus this fall, and could in fact be anywhere around the world. And so that's been a challenge that we've all been thinking a lot about. And I'm happy as we talk further today about what we're doing to support our on-campus students, our commuter students, and in fact, the truly off-campus that are not going to be physically present.
Yeah, no, unfortunately, we only have an hour because I'm sure all of us could talk about it for several, but I'm excited as well. And I look forward to all of us being able to collaborate and share with everyone. Keeping in the same vein, Marissa, why don't you tell us a little bit about your role in health services and what that looks like, again, this year compared to previous normal years?
Sure, Larry. So being the AVP for Health, Wellness, and Prevention Services, so I essentially oversee all the services for the campuses that serve our students in terms of health and well-being. So that encompasses student health services, counseling and psychological services, Center for Prevention and Outreach, Student Accessibility Support Center, and Recreation and Wellness. So as you can hear, there's a large range of services that we offer. And what I can say is that back in March, when we really learned about this was going to be really acknowledged as a pandemic, we had to shift our focus. We had to think about our students and how we were going to move from a face-to-face to a virtual environment and do that very quickly. Because in healthcare, you don't have time to close. There is no closing. So I would say that we did that shift rather quick. We always incorporated virtual environments into our service world, but we then had to go 100% virtual. So that shift was quite a shift. And then we had to think about how we were going to engage our students, keep engaging our students, and also keeping our campus community safe. Because even in March, When other campuses were closing, we never really did. We always had students staying here. So I have to say that Stony Brook University, especially our health services, have always been doing this work. So now with us reopening, we're going to continue to do this work, but just at a larger scale. So we've been planning for it. And what I would say the difference is that normally in healthcare or when we're looking at our needs of our students, we either think about disease specific or population specific. But with this pandemic, it's affected everyone. So there is no targeted population. Everyone and everything that we do, even down to our employees, our faculty, our staff, we've all been affected. So I think that that is really at the core basis of how we move forward and how we're going to continue through our session.
And I'm glad you mentioned the part about the students, because I think many people might not realize that we never really closed for sure. And from the student perspective, that we've been at it all along. So that we'll definitely have more time to get into that a little bit deeper. And Shelley, really the same question, the campus and the classrooms, what are things looking like now compared to, again, previous years?
Yeah, thanks, Larry. I'm really glad that Rick mentioned the number of online classes that we have, because that's a really important component here. And I think as people know, distance learning, that model has been around for a really long time. But this is very specifically distance learning in a pandemic, and that makes things in the context very different. I think that people, especially the people here, know that we take student success really seriously. We had the highest graduation rate at 64% last year, and we're going to continue as we move into the fall to be highly effective in our student success efforts. And some of the things that we actually learned, is Marissa said, actually immediately when we were transitioning into the remote and virtual environment, we shifted things very quickly and almost directly mapped our services seamlessly into the virtual environment. But I think what we soon learned is, particularly with students, many of our students being off campus and being online, that it wasn't just delivery of services, it was also methods of engagement. And so one of the things we found, I'm just going to say this is a little bit funny to me, is that many, many years ago, when I started in higher ed about 20 years ago, we were calling students. That was a thing. And we learned right over time that students were no longer being responsive to phone calls. It was email and texts and things like that, social media. But what we found in this environment was that the phone calls actually made more of a difference than the emails and the texts. And so we were calling students one after the other for check-ins as we moved into this environment. And we actually heard from students how much they appreciated that. It's just a really small example, but what I do want to say to anybody listening out there is that if you get a call from the university phone number, pick it up because we're probably calling you to check in. And so we're going to continue the success efforts that we have, but we're also engaging in some new deliveries. And the phone calls is obviously a very low-tech way, but I think my point is that we've doubled down in our success efforts, because the most important thing right now as we move into the fall is for students to know and feel that we care about them, that there are people here that care about their success and their degree progress, and the outreach and support that we can provide is going to be really critical to that.
And I think all of us individually will be able to talk about more. But if there were one theme, or two themes really, it's the empathetic approach, and that everything we're doing and have been doing from a planning perspective is in the interest of health and safety. We said that from one of the very first meetings, and we'll get into that a little bit too. But the pillars of our planning process related to good infection prevention procedures and wearing facial coverings and social distancing and all of those best practices, with maybe some minor modifications on guidance, they haven't changed, and health and safety has been emphasized from day one.
And I think one of the core elements of our planning process has been in how can we try to provide as many services opportunities for students based upon all different needs, because we know there are some students that they've actually, interesting through the process in the spring, they've preferred online classes. And so we've always said this pandemic has created a lot of stress for you, but also created a lot of positive change and thinking about different things. Shelley and actually, we were on a Zoom call last week with our Student Life Advisory Council. And one of the things that I found so interesting, we asked, how are you doing? What are your concerns? And it was a mix of students, both in person and online for their courses. And I think the biggest thing was students wanted to make sure their clubs and organizations were intact and that they could continue to operate. as normal. How do we engage students? And we had a long discussion about this is a really great opportunity, I think, for many of our commuter and off-campus students to get even more involved, because in the past, when we might have club and org meetings that might be in the evening, maybe a student finished their class earlier in the day, went home, and wouldn't want to do the drive back to campus that night. So we're looking at other ways. And I would say the technology and using Zoom, those have been such creative, technological outlets for us to ask students to think differently. So that's been, I think, a positive part of the conversation.
Yeah, I would say the same thing for advising, because our evening advising services, and that was also part of the transition. I mean, I think the business hours, the sort of quote business hours at the university can sometimes be really limiting for some students. And so when we shifted advising services, our advising services between 8 and 10 p.m. became the most popular hours that we had. And I think that that's something that we've learned now, is that that there became an opportunity to now engage students differently and get to maybe some of the students we weren't able to get to before because of the limitations they had with the other hours.
Yeah. And I think it's interesting because we were talking for a few minutes before the cameras went on, and Rick, Marissa, and myself, way back in March, which seems like 5 years ago, we did the first podcast. And at that time, we were focused on response. So it was the tone was different and our focuses were different because we had just accepted some. I won't get into it. I don't want to steal your thunder, Rick, but we had students that had returned from study abroad programs elsewhere, and we had stepped up as a SUNY institution to house them. But the focuses were different. It was on that initial response and what we were doing, and in the days, sometimes within the same day, the guidance was changing and our focus was changing, and we quickly pivoted to decanting campus and virtualizing everything, as you've mentioned. And I took on the role. I guess that one of my jobs, or the normal job at the time, was as the director of emergency management, the response to that. And this pandemic was different in a lot of ways, and I'll let Marissa get into that as well. But now, here we are 5 months later, and during the course of that, we've shifted to recovery and back to response as we get ready for the students to come back. And I just we'll get through each of you, I think, can touch on that, but the life cycle of where we've been, and it does really feel like a long time. Someone has affectionately called me the COVID Oz, which I'll take as a compliment, but as really my role was to shepherd the process through and to try to grab my arms around all the different areas. But we just took our pandemic plans and tweaked them along the way, and really just got the right people around the table and consistently did that. But it has been exhausting work, and I just want to reiterate that we've left no stone unturned. We have looked at this 360 degrees every possible way. I'm not saying that we've perfected everything, but we really feel as though we have taken health and safety as a priority from start to finish. So, Marissa, do you want to comment on from where we left off on that, whether it's take us back to March, if you want to briefly, and where that we look today?
Sure. I mean, I think you brought up a good point. We were definitely in a different position. I also think something that's very comforting is that our infection rate in New York State was also very different. And I think that we're positioned right now to bring our students back to campus at really an opportune time. Our infection rate, 3 days ago, I was on a webinar. It was stated in New York to be 0.7%. Could have changed in 3 days, but that's what the last number I got. And knowing that, that's way, way below the threshold that the governor put forth for us to open for all schools. So I think that we couldn't be in a better position. That position also assists us to implement our surveillance plans for testing. So I feel very confident that we are going to be off to a very strong start. And again, that's just the environment that we're in right now. So again, coupled with the hard work that we've done, I know you see Shelley and I with makeup on, but that's not always. So I'll just put that out there. We look good for the podcast today. But to say that we've, I think that our plans, they're strong, they're solid. I feel confident when I look at other university plans. I feel that we have closed many gaps if we've identified gaps, we've closed them. We've put action plans together to address contingency plans that even if a plan had fallen through, we have a backup plan. So again, I feel confident. I feel that we have systems in place so that students have processes in place that they can answer and ask questions. And again, I feel that with the current infection rate and with the density and what we've done environmental-wise within our campus community, we're positioned very, very well.
Well, I'd like to stay on that for a minute. And when you talk about density, it's from a lot of perspectives, and actually Shelley and Rick can speak to it, I think, individually. So let's take the housing first,
Sure.
And then we'll get into the classroom, the academic environment, because I think anyone who's listening definitely need to know that. And there's a different lens that where we'll look at for sure. So.
Yeah, I mean, to tag on to the health piece, I think obviously the last several months there's been the ambiguity that existed back in March has over time created greater certainty in the work that we do. And I think that has actually allowed us to move forward and make really informed decisions. And one of them does relate to housing. So early on, we made the decision, knowing for health and safety, that we would not have triple rooms. So we knew that was a decision point. And then we knew, and we felt comfortable, particularly in the health services realm, that we would have available testing to make sure that as we did surveillance testing of residents, we could manage those numbers. And so we originally had really upwards of the 10,000 number. I would say I don't think many students who then decided to drop out of housing for the fall was really related to health and safety. I think a majority was that we moved to a lot of online classes, and certainly it becomes an affordability factor, a cost factor for students to make that decision. So in fact, where we land today, we're actually at about 50% of our normal occupancy, which if we had every student in a single room, we'd be able to accommodate about 6,400 students in the residence halls. And in fact, we're closer to that number. And so it allows us a lot of flexibility in ensuring that most students are in single or some double rooms, allows us then for the testing capacity. We could talk about that as well, about what we have available, provides that flexibility for us to do more on-site testing for students. But we've now, the last 2 days, we've moved in all our first year and transfer students. So we're at about 2,500 residents so far. That'll double over the next couple of days. But we feel really ready. And the parents we've interacted with and the new students, I think there's a level of excitement. Again, as we've said to everybody, this is a different experience. I mean, who would have thought you would move your student to a residence hall and you'd be wearing a face covering? I mean, no one could have imagined that. But I have to say, people are following the protocols we've set up. We've done a lot of communication around that. I think everyone wants to know and see how we put health and safety as the top priority. And I, as Marissa said, I don't think there is another thing that we could have done to ensure the safety of our residential and campus community. So, but again, it's day by day. Even as we've said, it's hour by hour is
Absolutely.
The work that we're doing.
And I'll get to Shelley, but to your point, driving over here, I passed 3 bus stops on the way before the studio, and everyone had 2 students on either end of the socially distanced bus stop bench, which normally is 4. There was 2 facial coverings. So cautiously optimistic that will continue, but I think, and you had some feedback earlier today, Rick, at a meeting we had, that the students they're here, they're back, and they want to stay here. So I'm very hopeful and confident that
the other that I found so funny is if you haven't been on campus in a few months, and I think there's been some fear even among employees that are coming back. Once you come back, I think that the energy is there again. And again, we've said, follow the social distancing protocol, wear your face covering, no hugs, no handshakes, all those pieces we've had in place. Your daily app before you come to work and before you leave your residence hall, all those pieces are in place, as well as the protocol to follow if you're not well.
Yeah.
But coming back to the campus, it's literally, as I've shared with others, it is rebuilding the campus brick by brick. And so just the restaging of the campus, even in the furniture where the X's and green dots, and I even just saw it at one of the bus stations today, and I thought, it's like overnight. We went out there and reset the campus. And so again, I think from a safety standpoint, it's set to a place where it's a constant visual reminder about what the behavioral expectations are.
Yeah, and Shelley, I think all of that translates to the classroom as well.
Yeah, absolutely. Can I just say one thing though? Because
Sure.
I think what everyone's been saying has really been about the planning and the work that went into getting to this moment. And as you mentioned, that students really, they want to be here. They're excited to be here. And I think, and we've talked about this before, and part of that is the students and the community, as much planning as you put into place, utilizing the safety protocols, right, that have been put out. And so there's a huge responsibility for the community, all of us, right, on the campus. And I know that we've talked about that before too. And I think as students are coming in, I think they are excited to be here, and they want to participate in a way that's safe for them. And so, relative to the classrooms, when we transitioned back in March to the sort of full virtual environment, that was obviously a huge shift because there just simply wasn't time, given the infection rates and given safety, to do anything differently, and really was protective for the community. But with the planning, we really believe and want to provide a high quality academic experience for students. And some of that is going to include in-person classes. And so although some classes have been shifted online, and students, we've actually heard from a lot of students that are excited about having certain classes online and that it gives them the flexibility that they feel is right for them right now. There are some classes that are going to be in person. So part of the decision making around that was to try to prioritize smaller classes in larger settings so that social distancing could in fact be observed and could be maintained. Also shifting, a certain number, like I said, into the virtual environment gave flexibility for that. Time vectors were also changed around, which I think is actually a really big thing. Some people don't realize the significance of the time vector. So the time in between classes now is actually longer, so that students that are in-person classes will have more time to move between spaces and reduce density in hallways and as they move around campus. There's marked exit and entry points in our classrooms. Classrooms are being cleaned and sanitized regularly. Again, the way that the classrooms are set out as far as the sizing and the spacing and even the furniture arrangement. So talking about rebuilding, it even comes down into the way that the desks or the furniture have been arranged in the classroom, the way that the faculty area and the technology is actually positioned in the classroom as well. There's also been, some academic calendar decisions that have also shifted. And I think as people remember back in March, we made some adjustments to the calendar to try to facilitate students in this transition. A really big one was changing the GPNC option to a PNC option, extending that deadline to allow more students to make informed decisions about their grades during a really difficult time, as well as the withdrawal deadline. And although GPNC is we're going to go back to the traditional GPNC policy, what you'll also see is that there's a strategic decision to end all in-person classes on November 30th. And at that point, right, the idea is that students who are in in-person classes will finish out the semester remotely, and then all students will take their courses online remotely, will take their final exams online as they finish out the semester. So all of these things that have been put into place have really been toward both balancing, safety and keeping that as a significant priority, but also maintaining a really high quality academic experience for students.
Yeah, and would be remiss if I didn't give a special shout out to the academic task force as well as our registrar team that worked day and night to stretch that schedule, and really
they moved that schedule in a way that was beyond imagination.
Truly.
It was beyond imagination.
Truly.
Yeah.
So I don't want to leave anyone else. So I'll just say the team in general.
Absolutely.
But phenomenal job. But along the same lines, and I want to get to the question that's coming in from the live audience. So we have, I'll brag a little bit. Stony Brook is really in a unique position from a testing perspective. We're lucky enough to have the state-operated, the county testing site on our campus, and they've been here for a while. And we've done a tremendous amount of work. Marissa, the Health and Safety Committee that you chair has spent a tremendous amount of time on testing. So just bring us through where the testing options and what the requirements were for our residential students and what surveillance testing looks like moving forward.
Sure. So I'll start where students are moving in. We communicated to our resident students that you are unable to move into the residential housing unless that you were able to bring and show us a negative COVID-19 test. And it needed to be a PCR test. That test needed to be done within 14 days of your move-in date. We also had availability, as Larry was saying, to have our state testing here. We have been able to partner with a commercial lab, Enzo Labs, on site to provide testing on site for our students. So as students are moving in, even if they don't have that type of testing, they can actually get that testing done actually right at Student Health Services. Once students are completed moving in, Our ongoing surveillance plan is actually very, very robust. I will just, before I go into that, I just want to say that testing and surveillance has been a very, very, I don't, if I had to choose an adjective, I don't even know which one I would choose. It might be a hot topic, it'd be a controversial topic. Everyone and anybody in school or anywhere is trying to get their hands on testing. And testing could be any type of different modality. But the challenge with testing is, when do you do it? How do you do it? And how do you test such large numbers of students in a way, because testing only really tells you at that moment who is infectious. And testing isn't good enough. And when I say that, it has to be partnered and paired with a process called contact tracing. So if you have a student that comes back with a positive test, if you don't act on that positive test, then truly you tested for nothing. You have to put a process in place that if a positive test comes back, you have to do an investigation to see who that student was in contact with and how the virus was transmitted, and then identify any potential exposures. So I want to say that our surveillance plan is that once students move in, we don't stop the testing there. We continue doing surveillance testing, and what surveillance testing is that you're testing students that what we call are asymptomatic. Students that are asymptomatic are healthy, they're well, they're going about their daily routine. They may or may not, they don't know that they're sick. And that's why we do that testing, because we want to see and we want to make sure we know that this virus is problematic, and we know that many individuals are infected without having symptoms. So the surveillance plan is to test students in a systematic way while they're living on campus, and again, doing that with the ease of access to care by having the testing available through student health services. That's one arm of testing. The other arm of testing is that you may have students that are symptomatic. Symptomatic students need care, and they need care quickly. We're able to provide that care at Student Health Services, and we are able to provide COVID testing for students that are symptomatic. And those students would be identified either through contacting us, seeking care, or through our daily COVID-19 screener. So every student that, whether you're a resident or whether you're a commuter, is required every single day before they come to campus or before they have a face-to-face class to actually complete what we call a self-assessment. And they have been provided with, or they will be provided because they're moving in this week, a thermometer, facial coverings, and they have to answer questions, take their temperature, and they have to answer questions about their exposure and if they have symptoms to COVID-19. If they quote unquote screen in, it links them back directly to Student Health Services. They can link them in through a live chat, having a telemedicine consult with a provider, and then linking them into a COVID-19 test. At the time of identifying if the symptoms are truly COVID-19 symptoms, we would then make provisions for isolation and then identify through contact tracing for quarantine and identifying those exposures. So it is a very complex, and I'm not going to go through every single process. I think I might have even confused some people who may be listening. I don't want to just focus on resident students. This process with testing is also offered to our commuter students. So we have offered to our commuter students to come and get tested through Student Health Services. Commuter students who do not live on campus are still required to do the COVID-19 daily screener, and also our employees. So employees who are working here every single day before they come to work, they are required to do the COVID-19 screener. And the process that we built is pretty much mirrors the process for a student. If you screen in, you need to contact your supervisor. You need to leave work immediately. The message is, do not come to work if you're sick. And we link them to a healthcare professional. You know, it's interesting because not every symptom is COVID-19. And we have to differentiate that. People still do wake up with migraines, and people do wake up with sore throats related to allergies. So we've really structured our services that we've been able to have healthcare providers be able to speak to our employees and also our students to really kind of decipher, what is the symptoms that you're experiencing, but most importantly, link them to the testing that they need, have them in an environment where they're not in the campus community or isolated if they live on the campus community, so that we prevent the transmission of infection. And again, like I said, we've been doing this work since March. We've never really closed. And what we've done with reopening or adding capacity to the campus is that what we've done is just add capacity to this plan and really just have expanded it.
Thank you. And
What did I miss?
You didn't miss anything, actually. You answered a question that came in the process. So if you're just joining us, we're here today with Marissa Bisiani, Rick Gatto, and Shelley Dramana, talking about all we're doing to welcome back students to a safe, secure campus this fall in this special episode of Stony Brook University's Beyond the Expected podcast. And I would like to just continue on that, but I want to switch to Rick. And, while we are laser focused on safety and health, we also understand that we will have 5,000 resident students or so. So here's the question, the burning question, Rick, is what are we going to do with them? And how are we going to offer, what would not be traditional programs in a non-traditional way, or what does it look like for a student on campus?
Sure. So that is obviously the burning question, and we've all been working on with our amazing team and colleagues to create a robust student life. We always say academics are the priority, so I hope with Shelley, that needs to be her admonition of the group to study. And I will say one quick point. As Marissa was mentioning, one of our protocols related to starting our campus in a healthy, safe way was we did the precautionary quarantine for students who were overseas or from restricted states. And so I had the good fortune of doing a Zoom call last weekend with a lot of our students in the 14-day quarantine on campus. And I asked, what are they doing? And one student who I thought was fantastic said she's prepping for her calculus class. So I thought Shelley would be very pleased to hear that.
I love that.
Without a setup either.
Right.
That wasn't
So that made me very happy. So I said she's the one we want to role model. But in terms of then the campus life piece, so all of our students are here. We've already done activities as we welcome new students. A few things as kind of protocols we followed and we've shared with our clubs and organizations is that for any in-person events on campus, we're restricting and limiting that to 50 students. And so obviously in those environments, any indoor space, physical distancing, face coverings, there's obviously a lot of protocols related to food, how we work events. But again, the technology has given us a lot of creative outlets. And so we're able to do the virtual program that not only is good for resident students who are on our campus, but that means that the off-campus students can participate as well. So I do want to highlight, if you look at your Cork app, that is our tried and true real-time list of everything going on this campus. So for students who have not downloaded it yet, it's CORQ in the App Store. You'll do your net ID and password for Stony Brook. And not only can you see all the clubs and organizations, of which we have 350 to choose from, you can also see all the events going on campus. I also want to point out, too, for health and safety reasons, all of our events on campus will always be a pre-registration process. And I think that's, again, another important point, because for line queuing purposes, you can imagine we don't want to get a lot of students in a group waiting to go into a venue. And so that's another way. I'm asking students to do a little bit of planning ahead of thinking about what social activities or events they want to be involved with. But there are lots of great things. And I do want to highlight, there's going to be drag bingo virtually this weekend. So by the way, we are going to, be reopening the rec center, which is another important thing that, fortunately, with the governor's guidance, allowing up to 1/3 capacity, we have a protocol that we're working on in place to make sure that in between groups, again, it'll be more of a scheduled visit, but that we'll do a lot of sanitize in between, visits. So I think we have a lot of good things in place. So again, if you see the Cork app, you'll see a lot there. And I do want to encourage all of our students, watching us today, for clubs and organizations, we're able and willing and happy to work with you to come up with events that would work, whether it's a hybrid form, a virtual form, or an in-person opportunity for students.
I was very excited to see the Star Wars movie being offered.
Yeah,
that's shameless plug. Is that tonight's movie, or is that Sunday night's movie?
It's the one that I think is.
I think it's
rescheduled.
Yeah, it was for Thursday.
I think it was the one that was rescheduled.
Okay.
Yeah.
So while they're not participating in those activities, and when they will be in the classroom, which we
That's right.
we want to focus on, you mentioned sort of the different look and how we de-densified and the new approach to synchronous and hybrid and in-person classes. Can you just talk a little bit about how that design went? And then there's a lot of questions about, remote work, or if someone is sick at home, or office hours or things like that. So just maybe touch on some of the academic FAQs that we're getting.
Yeah, that's great. Especially around, I think a lot of students, one of the concerns that we've been hearing is about if I get sick, so what happens then? Like, what am I supposed to do? So absolutely. So, in terms of the different offerings, there was a lot of input from departments, from dean's areas, obviously from the planning task force around which courses would really work well. Because I think part of, again, as you mentioned, it was a lot of crisis mitigation, right? When we moved into this to make sure we were protective and that everyone was staying safe. And, that's going to be different in terms of what students are going to see as we move into the fall for the courses. There's a lot that had been offered to faculty over the last 6 months. There were, CELT is, has been a fantastic resource. And there were, online boot camps and really taking a look at curriculum and pedagogy in the online and the hybrid environment. So for students that might not understand the difference between synchronous and asynchronous, right? An asynchronous class is essentially one that you kind of do at your own pace or at sort of a pace set by the faculty member, but it's not necessarily something you show up at the same time every week. And in synchronous class, where in that model, it's more like you show up at the same time. And the hybrid is a little bit of both. And so what we've really been telling students is make sure to read Solar, make sure to look at what the course is listed as. That's really important. And also reach out to the faculty to confirm what your understanding is and what it says on the syllabus, especially if students have particular needs in terms of synchronous or asynchronous. So there was a lot of work done in terms of flipping the right courses right into these different models that, again, could still maintain a high quality academic experience. And so that I think there's been a lot of work done around that, particularly from our faculty. Faculty office hours, I'm going to put kind of a plug in for office hours too. So faculty have always been required to have office hours and maintain those office hours for students. It's one of the biggest resources and most underutilized resources that universities have. And that's not just here at Stony Brook, that's across the board. It is a really big resource. So there will be, in fact, different formats of office hours. Students should check, depending on what their needs are, should check with faculty, and also depending on the course format, it may be different. But what I will say about office hours, and this is actually my shameless plug, not Star Wars, is that if any student out there has heard me talk at orientation, I often do a welcome at orientation, and one of my top 5 not so secret secrets for Stony Brook students is to engage in office hours. And I challenge students that in the first 3 weeks of every semester, they should be visiting the office hours for every professor that they have, just to introduce themselves. Say, this is my name, I'm in your class, I'm really looking forward to being there. I don't know how many actually take me up on that, but I would say it again, particularly in the virtual environment that may make it easier on students to connect with faculty. Please do that. And, I'm just sort of making this up on the spot. For the first 10 students that email me and tell me that they did that, I will personally send you a swag bag of Stony Brook things.
Wow.
So I'm
and
literally,
that's on the record.
it is on the record. I am
Okay.
making it up, but I feel that passionately about office hours. So please.
As an adjunct faculty member myself, I appreciate that.
I know. It's such an underutilized resource. So anyway, so that's sort of, I don't know if that answered your question.
Definitely.
But there's
answered my
swag
question.
bags. So
I think you got their attention if they weren't before.
So I actually wanted to share one other, this came actually from an advisory council member back in the spring after they'd experienced the online classes. And one of the things I found very interesting is that in an in-person class, oftentimes a student may be, a little bit concerned at raising their hand to ask a question. But the feedback that I'd heard was that in the synchronous online classes, through the chat feature, say in a Zoom class, maybe the anonymity of being able to just, I can pose my question.
Absolutely.
I heard a student say, the professor couldn't get through the material because there were so many questions that came up. So again, I think it's a different level of engaging students in a way. And again, it's all about learning. And if this is a way for students to connect and learn differently, I'm actually so glad that people have had that opportunity.
I agree. I know, Larry, you did ask about the health piece of it, and I do just want to, because I do think that's important.
Sure.
Students are concerned about it. So obviously, and Marissa, you've talked about what students should do, right, in terms of the symptoms or in terms of their health screening. So I'm obviously not going to get into that, but obviously health and safety is the most important thing. And so our faculty are encouraged, have been encouraged. It's very clearly that for any student that you absolutely should not go to class. So if you have an in-person class, right, you absolutely should not go to class. Email your professor right away. Let them know what's going on. Obviously, as Marissa said, there's processes and protocols in place for engaging in terms of the health piece of it. But don't go to class. Email your faculty member if it's an in-person class, and find out how you can get the work, right? How you can, and faculty are being encouraged to work with students in that capacity. For the online classes, what we've been telling students is work as you can. So if it's an online class, continue to work if you feel up to it. If the illness is really impacting you and you just feel like you are not well enough to engage in that work, again, communicate that with your faculty member. And in a worst case scenario, because I do think for some students, they need to feel like there's an out, not, that there's an opportunity for them not to feel stuck if this were to happen to them. Students can always take a medical leave of absence. And so at worst case scenario, there are opportunities, and we will always, advising will always work with students to try to figure out what that would look like in terms of the student's degree progress. So we don't want students to panic if they do become ill. We want them to take care of themselves, get the help that they need, and communicate to the people that they need to communicate to so that they can still be successful in their classes when they are well.
And Shelley, I wanted to add and actually ask Marissa, because one other thing that we're concerned about is that if a student does the app or they forgot that one day and they weren't feeling well and they thought, well, the next day I feel better, I'll go back to class. We really want to make sure that you do call Student Health Services, because if the advice is to get a COVID-19 test, we expect students to do that and then actually stay out of class till they get the results. So that's a really important part of it.
Absolutely.
So we just want to encourage, it might not just be, I don't feel well today, but I'm fine tomorrow. We really want everyone to take the advice of the medical professional. And given the examples Marissa used before, whether it is a migraine or other symptoms that may or may not be COVID, let the medical provider make that judgment.
Absolutely.
Absolutely. I think that's so important. I'm glad you stressed that. We certainly don't want students or anyone to take this into their own hands. It's so important. And I think that's what's so tricky about this virus, because the symptoms are just so broad. I mean, one of them is loss of taste or smell, headache. We've been very, very careful and strategic to, really specify it's new or worsening. But again, that conversation is important. And we've really positioned, and then Rick, this is where you come in, is with our student support team. So we have professionals on campus that are aware that, Stony Brook is not the only university that is using this app. The app is called Campus Clear for Students. Every university is doing this. It's actually through the New York Forward guidance through Governor, and it's a requirement. And I think that, this is when we talk about what's different than what has been different the way we used to, is that now going and going to school and our daily activities is associated with making sure that we are symptom-free of COVID-19 symptoms. So this is not something that is punitive. This is not something that faculty is not aware of. They're actually doing the same thing every single day before they come to work.
Yeah.
This is just something that has been embedded and grown into our environment. And again, there are our staff and professionals here to support you. So when I talk about the words isolation or quarantine, I as a professional, when I first started doing this work, Rick will tell you, I really don't like those words. I've actually coupled it. What my plan is called supportive isolation and supportive quarantine, because that's really what it is. It's not about identifying, students that are index cases or infected and putting them in quote unquote isolation. It's not about that. It's really about just keeping our campus safe, identifying anyone who's symptomatic, and giving you the resources that you need to get better, do well, have academic success, and also just prevent the transmission and spread.
And we're in this together.
Exactly.
I mean, that's a big part of it, is we are in this together with our students and for our students.
And yes, very much so. And I think, we early on, we said, it's a marathon, not a sprint. And I think at some point I said it's a triathlon. And at some point we said it's a super marathon. And as far as along as we've come and the progress we've made, we're not out of the proverbial woods yet, right? So our goal was to get solid, really thoughtful plans together. And I go to sleep tonight for a little bit that I will get with the notion that we're in a really good shape. The question will be, we're opening. can we stay open? And I think a lot of that will do with the behaviors of students, faculty, and staff. So I did want, Marissa, just to give you a few minutes to just touch on that and why it's so important. We see the cases, all over the country, other institutes, and won't call any of them out. And but our plans in comparison to them, we certainly took a different approach. I think one of our key approaches is the requirement for negative COVID testing for our residence halls. I think that will be a key indicator of our success, as well as robust screening that we're doing and testing. So, if you had one piece of advice for our students off campus? What can they individually do to make sure that we remain open? And then I will get to the question, because it's an important question.
One thing, several things. And it's so simple. I mean, we hear everyone say it, that almost, I think our community becomes tone deaf, but they shouldn't be. Why is it that New York is so successful? I won't say Stony Brook University, and I won't say Long Island or Suffolk or Nassau. Why is it that New York is actually identifying states to say that if you come into New York, you're going to be quarantined? And I'll say it is because we're following the rules. And those rules are facial covering, good hand hygiene, social distancing. And that's what I would say to our students is, like, we put everything in place as administrators to do the best we can to have the policies, our pandemic planning committees. We've been up tirelessly doing the work, but it's a partnership, and we need you to be invested in that partnership. And that means that pay attention to the rules. Continue what phase 2, phase 3, phase 4 of opening New York is. It doesn't change because you come to Stony Brook University and now you're in college. All those behaviors need to continue because that will close the university and it will put us in a problematic state. And I don't think anyone here wants that. I know that. We all want to be successful. We all want to be symptom-free. We all want to continue to see our loved ones, our friends, even if we can't hug or kiss them, just to see them again and not be where we were in March, where, we were in our homes and isolated, and those feelings of loneliness. I could share with you with overseeing the counseling center. Our volume for summer went up 40% compared to last summer. It's significant. And those are feelings that I think that, especially with the favorable weather and it being summer, everyone's in a much happier mood, and it's really a great time, and it's a great time to celebrate. But it's also not a time to forget how we got here. So I would say that please don't forget to follow our pandemic policy for health and safety. Think twice before you engage and you do unnecessary risk. That's what I would say.
Yeah, I think actually it's a perfect answer, and one that we hope resonates with everyone listening. And I'm going to take a stab at the question, and then I think each of us can give our 2 cents. So the Facebook Live questions coming in is, what is the outlook for 100% return to campus in the spring? I think all of us would say we would love that to be the case for a myriad of reasons. First and foremost, we have to follow the guidance of our state and local health officials. That will be the case consistently, as well as SUNY. We will only consider those options depending on infection rate and all the other factors that the regions have to comply with. But I do think looking forward, right, we looked back, we were in the midst of it, and we moved forward on our planning. We're starting to think about what the fall looks like. So I just want to give everyone an opportunity to comment on that. Whoever would like to go.
I can start. And I'm sure that, Rick, Marissa, I'm sure you probably might have sort of more to add to this. But in terms of the academic environment, and this is just specifically around course scheduling, meetings have already started around course scheduling for spring and about what that might look like. So I don't have any firm answers right now, but those conversations have been happening, are happening now, and will continue, and again, as you said, and particularly based on the guidelines and the guidance that we get. So there are several different scenario plans right around spring course scheduling that are already being looked at.
All the people that we gather in a room, they're not off the hook just yet.
That's right.
They're still much to their chagrin.
Yeah.
Well, I would just say I think it's day by day, as we've said. And I think I'm going to say time will tell, because it's all about, as Marissa just said, it's all about the behaviors of our staff, students, faculty, everything. If everybody's following the protocols we've set up, I'm really confident that we will stay open and continue, because I think as we think about any organization, you look back at what your history is and you say, okay, let that then predict your future. And so it'll be predicted based upon what happens over the next, 60 days.
Yeah, that's great.
And can I add one other piece too, just related to, I know we talk about off-campus students. One thing that I'm really hoping to is within our residential community, we've talked a lot about students staying within their pods. And so I want to encourage all of our resident students and even commuters as well, stick within a smaller group. This may be a really amazing opportunity to become really close with a much smaller group. In fact, rather than the traditional way of meeting lots of different people at large events, these are chances to meet and develop, I would say, really deep friendships with smaller groups of people. So I would just think as students traverse and try to meet people, stay within your suite, within your floor. I think those are good opportunities to really get to know people very well.
And I want to be mindful of the time. I want to give this one to Shelley. So it's a great question. If students are taking in-person only classes and need to quarantine for 14 days, how do they make up? What's the advice for making up the instruction and the work?
Yeah, absolutely. So that student or any student would want to email their faculty member immediately to let them know of the situation so arrangements could be made. And there's some different ways that can happen. One way that some faculty are going to be managing it is they're going to have their lectures recorded. Students would be able to actually watch the lectures either live or afterwards. And in terms of making up the work, the faculty members are going to work with students so that they can make up instruction during that time. So they can do it. There's a couple of different ways depending on the class format and depending on the class that it is. It gets a little bit more challenging for some of our lab classes, so I will say that. But again, faculty they have had the conversations around what would need to happen in this kind of a scenario. And so even for our lab classes, faculty are being encouraged to work with students. And that may mean some additional time on the students' part, sort of after the quarantine period. But there will be opportunities provided so students can complete that.
And can I add just also one other piece of communication that's important with this is that we talk about also respecting students' privacy and confidentiality in this. It's really important.
Good point.
So just as we walk through the process, it really all starts with the student making contact with Student Health Services, and based upon their advice and counsel in terms of determining where a student, what they should be doing, if then they do need to go to quarantine either through contact tracing or there's been an exposure, that information does go to our student support team, and the student support team does send the confirmation to the faculty member so that the faculty member is aware that we have documentation, but we do not share what the issue is. We just let them know they'll be out for a period of time. If a student chooses to be forthright and share that with the faculty, that's their choice. But we just want to be clear, we never share that private information with anyone.
That's great, Rick, because I think some students may actually be wondering, what happens on the front end of that, right? So how do you get to the point where you need to quarantine and now trying to figure out how to make up work? So thanks.
Yeah, that was a great segue. I just want to mention, because I did forget to say, that contact tracing is a completely confidential process. There is no, revealing of who is infected. We do not convey that. That's held with the healthcare professionals, and we do contact tracing in collaboration with our Department of Health. So that's the only person that really we would provide a name to.
So just in the last 7 or 8 minutes, I want to give everyone an opportunity to, some closing remarks, last minute thoughts. And I'll start off just by saying, I'll reiterate my thanks certainly to my colleagues here, but there are so many that have been involved. The list is long, but the listening audience should know that there's hundreds and thousands of hours that have gone into this, and we have been as thoughtful as possible. The word of the day has always been nimble and flexibility, and we will continue that. Expect to see a survey as you come back. Students, faculty, and staff will be surveyed. We want to know how we're doing. We want to know what things look like. We want to assess our plans and be able to make those changes as they come. So I'm excited. I'm confident, and we look forward to continuing to welcome our campus community back in the coming days. So, Shelley, we'll start with you, just with some closing thoughts.
Yeah, I think if I'm communicating directly with students and families, I want to give some tips in terms of moving into the semester in terms of the academic environment, and just 2 really quick ones, because I think I think it's more important than ever to be proactive as a student in terms of your needs and in terms of the support that you need. We know that engagement is really critical to students, and part of that engagement is also around advice advising support with your faculty. So what I would say to students and families is please be even more proactive in reaching out to the resources. The tutoring resources that we have are virtual. Reach out to those resources, utilize them, show up for classes. So even regardless if it's in person, asynchronous, synchronous, hybrid, show up for them. Be there, be present, be engaged. And most of all, I would say if you have not been using advising services up until this point, please start. Utilize those 8 p.m. to 10 p.m. hours if you have to. There's going to be a variety of opportunities to engage with advisors, but they really are a critical juncture, a critical connection point for students on this campus as far as their degree progress.
Thank you very much, Shelley. Rick?
Great. So a few closing thoughts. One is that, as Shelley kind of said this at the top, is that we want our students to know how much we care about them. And we care about you. We want you to be successful. Part of the work I think we've all done together as a university is to make sure that students' progress towards graduation is not impeded. And I think that's been the mile marker, right? We want to see students make progress toward graduation. So a few things I will say, as I said at the top, about the different populations that we're serving. If you are a fully online student and not on this campus, please connect still with all the virtual advising opportunities, virtual career opportunities. We have a virtual involvement fair coming up in a week. We have virtual job and internship fair. So please utilize that, because anything that was once the large in-person event has now gone virtual. We haven't eliminated anything. We've actually enhanced it to then go to more students. So that's, I think, a really important point. Two other things I just wanted to share briefly. One is, in all the health and safety work that we've done, I do want to give a special thank you, not only to all the folks in the student health realm and the whole team working together, but I do want to thank our SPVAC group, because they've been, as a student-run volunteer ambulance corps, we have partnered with them now through this pandemic as well, and they continue to do amazing work and will this fall. So I want to give thanks to them. And last thing I want to say for students who are on campus, I hope as you have arrived to campus or will be arriving, I do hope you will get to experience and walk into the newly renovated Union. It is a beautiful building. It is meant for you as students. It's a wonderful place where all our services are all co-located. So please do make the visit, because we want you to feel that there's been great value in your experience at Stony Brook.
Great. Thank you, Rick. And Marissa, certainly last but not least.
I'll be very quick. I can't believe the hour's almost up. I don't want to forget to mention that Student Health Services is now actually open 7 days a week, which is very, very different. So we also have 24-hour access to care. And what that means is after we're closed, we have a telephone access to care. And then we follow up the next morning and we receive all that information. There's a registered nurse that will answer your calls. If you get sick, we want to know, meaning that even if you seek care from an outside provider and you're COVID positive, we do want to know, because there is some possible activity or transmission of spread that could have happened if you visited campus. So we do want to know. And even if you think that we don't need to know, again, let the healthcare professionals make that determination. And last but not least, I do want to mention that everything I'm talking about in terms of testing and surveillance is no secret. And what I mean by that is we are going to have a dashboard that will show the actual number of tests that we're doing and the actual number of positives. You'll see also the quarantine and isolation numbers of how many students are in there, amongst many other things. So I don't want to go through that right now, but just be on the lookout. That should be available probably within the next week. So thank you, Larry.
Thank you very much. And I'll just reiterate my thanks for certainly for Marissa, Rick, and Shelley for joining us today. But the senior leadership team, Dr. McInnes, and all of the planning groups that have worked together tirelessly deserve a special shout out. And again, we're in the best possible position, and I'm anxiously looking forward to it. So thank you again for joining us for today's Timely Beyond the Expected podcast, coming back safe and strong, welcoming back students. For all of our listeners, and particularly our students who begin fall semester this Monday, we hope you found our campus experts' information, insights, and advice helpful, and wishing you a great, healthy, and safe return to campus. Thank you.